My name is Mohamed Sayaqle. I'm the chair of Bristol Somali Youth Voice organization based here on Eastern Community Center. We mainly work and support the young people from disadvantaged background, and the social action project that we need to talk about today is the COVID and the work that we did during pandemics.
My name is Ahmed Ismail and I'm a youth champion worker for Bristol Somali Youth Voice. What we did within the pandemic is increase the uptake of the vaccine in low deprived areas such as Barton Hill and Stapleton Road, and within the BMA community, especially with Somalis as ourselves. The uptake wasn't very high. So what we did is we went out there with vaccine clinics, went out there to talk to people, change misconceptions, have a dialogue with people, and I feel like it's better for young people, especially like people like myself, getting the message from people that look like you, people that talk like you, and people you've been around, the people that you know.
Bristol Somali Voice mainly work, inequality groups who've been, struggling with the challenge of deprivation, poverty, and again, on the top of that, the challenge of the COVID. The community champions of Bristol Somali Voice, they come from the community. So the message comes from grassroots level, not on top and TV. It comes from people who know the beneficiaries, who work with, who live with the inequality and the challenge of the inequality. We all live in BS5. The majority of our staff, they live in Barton and East. So they live with the challenge of the inequality. Some of them go to the academy as a school. So they know, the challenge, in various times.
What we did to promote the vaccine is we worked with faith groups, we worked with doctors, and we worked with the clinic. So the clinic was a walk-in clinic within Stapleton Road. So what we did is we went out to the area, went into cafeterias, we went into shops, we went into the local people walking around, and we spoke to them, and we gave them advice, and we told them there's a clinic here. If you've got any questions or whatnot, we can have actual health people that can answer your questions, any worries that you have, and you can speak with us. So we created a dialogue and a conversation, and we bring them towards the place. So it's not like a thing where we force them, but it's a thing where we increase the trust. So once you increase the trust and information as well, I feel like a lot of people are misguided and miseducated. So what we did was educate the people and help them in that way. And then in the end, a couple more people turned out, more people do turn out, and they do tell their friends, and they do come and take the vaccine.
Inequality caused deaths, I believe, during COVID. And COVID exposed, how the social and the health inequality has been issue in our city. Bristol, it's a vibrant city, but when you see the inequality in the city is real. The lifespan between Creditline and Barton Hill is 15 years difference. And, the COVID just exposed and exacerbate, existing health inequality in our society. The power of our story is, like promoting the vaccine uptake. The message comes from the people. We inspire the people to be messengers, like the faith workers, business stakeholders, community leaders, and the young people. And then they collectively promote the vaccine together with us because of the trust and the relationship that we have in the community. And because we live in the area, we work in the area, and we make sure the message comes from the area as well. But also importantly, that collaborative work between the NHS and the Bristol City Council, especially community development team, because the council is a big, we should put the credit where it lies. Community development team, we develop that, that relationship, that working relationship, which grow stronger during COVID. And we deliver good work together, whether that is supporting vulnerable groups affected, by the COVID, or whether that is, promoting the vaccine and building that grassroots communications. So I will choose the power of the people and also that collaborative work as well.